Saurabh Sharma. I'm a fellow in cardiology at Albert Einstein Medical Center, Philadelphia. Today, I'm pretty excited to discuss with you my research paper, Normal Weight Central Obesity and Mortality Risk in Older Adults in Coronary Artery Disease. This paper is published in the March issue of Mayo Clinic Proceedings. As we all know, obesity is a growing health problem all over the world. According to the National Center for Health Statistics data, in 2007, the prevalence of obesity in older adults aged 65 and over was found to be 35%. Now, there are many objective measures of obesity like BMI, waist circumference, and waist to hip ratio. However, the usefulness of these anthropometric measures of obesity as predictors of mortality in older adults is not well defined. There is very little consensus as to which measure of obesity is most strongly associated with cardiovascular disease risk in elderly populations. Other important point is, even though the current AHA and Obesity Society guidelines recommends to use BMI and waist circumference for adiposity-related risk assessment, the guidelines neither address the importance of combining BMI with other measures of central obesity, nor did it address the best measure to be used in elderly patients. Our research study's objective was to study the relationship between BMI, central obesity, and mortality in elderly subjects with coronary artery disease. We used 5 cohort studies from 4 countries: United States, Denmark, France, and Korea to get our final study sample of more than 7,000 patients aged 65 and above. All our patients had coronary artery disease at baseline based on a previous history of myocardial infarction, percutaneous coronary intervention, and or coronary artery bypass grafting procedures. We divided our patients into 12 groups based on the combinations of BMI and central obesity measure of waist to hip ratio and waist circumference. We used Cox proportional hazard models to investigate the relationship of these anthropometric categories on the mortality endpoint. When we combined waist to hip ratio with categories of BMI, we found that when compared with patients who had normal BMI and low waist to hip ratio, patients who had normal BMI and high waist to hip ratio had the highest mortality risk. Patients who were obese based on BMI but had low waist to hip ratio had the lowest mortality. When we combined waist circumference with categories of BMI, patients who had normal BMI but high waist circumference had the highest mortality risk as well. Upon evaluation based on waist to hip ratio alone, we found that patients with high waist to hip ratio were more than 2 times likely to die when compared with patients with normal waist to hip ratio. However, a high waist circumference alone was not predictive of mortality in the overall cohort. We also analyzed sex-specific associations of mortality based on different combinations of BMI and waist to hip ratio and waist circumference, and using independent anthropometric measures also. I would encourage all of you to refer to our paper for more details regarding the surprising results. So in a nutshell, we demonstrated that patients with normal weight central obesity based on a combination of BMI and waist to hip ratio or waist circumference had higher mortality estimates compared to subjects with normal, overweight, and obese BMI without central obesity. In men, the combination of BMI with waist circumference, and in women, combination of BMI with waist to hip ratio may provide additional prognostic value. Hence, in clinical practice, we strongly recommend to combine measures of total and central obesity in adiposity-related risk assessment in elderly population. I encourage you all to read the research study in the March issue of Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.